Okay, this is my interview. My name's Heather Walski. I'm a psychology major and a sports studies minor. I'm here with,
My name is Dennis Hoyer. I'm a clinical psychologist.
and yeah, so let's start off with what degree did you get and what present title or position do you have?
Yep, so undergraduate degree, I had a bachelor's in psychology and theology, and then I did a master's in psychological sciences, and then at Auburn University I did my PhD in clinical psychology. I'm currently a clinical psychologist working at the Department of Veterans Affairs.
Okay, and you said you went to Auburn University. Did you go anywhere else or just?
Yep, so I did my undergraduate degree at a very small school in Ohio called Franciscan University. So I was there for 4 years, and then I did a 2 years master's program at Catholic University of America in Washington, D.C. And then I did 4 years at Auburn University before I got my PhD.
How many years have you been working as a psychologist?
So as a licensed psychologist, I achieved my license actually in the middle of last year, so middle of 2024. I've been working, I was what's called a graduate psychologist after 2022. And that's where you're able to do the psychology work, but it's under the license of somebody who's already licensed. So they supervise you, and everything falls under their license. So I've technically been working in the field of psychology full time since 2022, but as a licensed psychologist, it's been about a year and a half.
What was the reason you pursued this?
So in undergraduate, I wasn't entirely sure what I wanted to do. I was double majoring, I was majoring in theology. So theology really interested me. It's a little bit loud. And I took an intro to psychology class, and I just kind of fell in love with it. I thought it was so interesting. And because I was already majoring in theology, I thought it was interesting how there were some ways that the two worlds could kind of mesh together. So I did a lot of thinking about that, and then I just kept signing up for more psychology classes and taking more classes, and I loved each one. And then I knew for certain I did an internship during my undergraduate year, where I worked at a facility for people with severe mental illness, and I really, really enjoyed that. And from that point on, I was certain that was the field that I wanted to pursue.
How'd you get an internship and during your undergraduate? Like, how'd you go about that?
Yeah, so that was technically a requirement that we had just within the program. So they kind of put it on us to just kind of reach out to local places, just to do some volunteer work for them. And so it was about 10 hours a week at a local facility, and I just make calls to local places that I knew specialize in mental health. And there was a place that could use some assistance. So I'd go probably 4 hours a day in the summer, and so just kind of calling around and seeing who could use help. A lot of areas, mental health feels pretty understaffed, so they're pretty willing to take volunteers, people to help out.
What is the most enjoyable or favorite aspect of your career?
There are a lot of things I like about it. I think for me, when you have people who come in and they're not entirely sure what's going on and kind of why they might be responding to things in the way they're responding to things, or why certain things might be affecting them in the way that they are. Sometimes it's sad that you'll have things like their family members telling them they're crazy or that there's something seriously wrong with them. And when you can explain it to them, kind of here's how some of this happened, and here's kind of what's keeping it going, and there's also a path forward, and there's a way to work through some of these things, so it's not affecting you in the same way anymore. Just being able to offer that hope for them, and then to actually see the changes happen firsthand, it's very rewarding.
Now, on the opposite side of that, what's the least enjoyable part of it?
Yeah. There are a couple things. Two big ones come to mind for me. Number one is when you're working in the mental health field, and especially when you're doing clinical work, like doing therapy for people, when you have people who are there who really don't want to be there, it's like their spouse made them come in, and it's kind of like an ultimatum kind of deal. A lot of times just the motivation won't be very high to make any changes for themselves. So that can be challenging in its own sense when someone's there just because it feels like someone's twisting their arm to be there, because it's a lot harder to get the buy-in and see them kind of make some of the changes that would be most helpful for them. And then I'd say the second most difficult thing, as I mentioned earlier, the field itself can be pretty understaffed. So I feel like I do one thing, but sometimes I need to refer something out, something maybe I don't specialize in or something I don't have a lot of experience in. And when there's not a lot of good referral options or good places to send people, you can feel kind of stuck. So that can be kind of frustrating in itself.
Do you feel your career is respected by coworkers and others?
I do, yeah. So I actually work in a primary care setting. So I do what's called primary care mental health integration. So at the office I work at, it's mostly medical doctors who are seeing their patients for routine appointments. They'll come in for a check-in or their first initial appointment, and then they'll do screening for different mental health conditions that a lot of people may be affected by, and then they will refer them to me if it seems like the person might be able to benefit from mental health treatment. And I've been able to develop pretty good relationships with the medical doctors and nurse practitioners I work with, and just communicating with them and keeping them in the loop of what I'm doing. That's helped create a lot of buy-in, I would say, for kind of what I do. And I think it's been, all in all, a very strong supportive relationship between me and the rest of the team.
Do you feel that monetarily you are compensated fairly?
I do now, yeah. It took a while to get there, I would say. So in my year of internship, right before I graduated my PhD, I made very, very little, like less than anyone in the building was making. So that was a tough year. And then even before you were licensed, you're not paid a lot, but then after you get your license, it feels like it's pretty fair, and I'm pretty happy with it.
What aspect of your career would you change if you could?
Aspect of my career would I change if I could? It's a good question. I would say, for me personally, this is just kind of a personal opinion. I mentioned earlier that the mix between theology and psychology was something that always very much interested me. Now, sometimes I'll have veterans who come in who I'm seeing who are talking about their relationship with God, and that relationship to them is very important. So we're able to talk about that and discuss that. But I always, would love the opportunity to be able to kind of even more intentionally blend the two fields together.
Yeah. If you had to do it over again, would you still pursue this career?
Absolutely, 100% I would. I'm very happy with it, and I wouldn't change a thing.
So I know we kind of just met, like I know your wife as my teacher, but would you recommend me to pursue this field?
Yeah, I would say a couple things. A lot of it just depends on kind of how things go for you over the next few years. The big thing is, in psychology, you're constantly learning. So much of the field, I'm sure that already in your intro to psych class, they talked a lot about research. And probably even, I remember in my first intro to psych class, I was thinking, why are they talking about all these research studies? Like, I don't really understand how this all applies to actually being a psychologist or being a counselor or someone who does assessments. But the further you move along in the field, the more you understand the importance of the research. So I'd say for you, if the research and the things that you're learning about is interesting to you and it's something you can imagine continuing to learn about, that would be a good indicator for you that the field would be good for you. Because even after you're licensed, continuing to learn and follow the research so that you're following the best practices and the work that you're doing, that's a really, really important thing to do. So the big thing I'd be thinking about is, number one, am I enjoying the types of things that I'm learning about and the types of research that they're presenting me? Number two, do I think I could enjoy continuing to learn about these things as time went on? And number three, could I imagine myself taking what I'm learning and as it gets a bit more applicable for you, which I think it will next year or next semester or the following years, could I imagine myself applying these things and actually spending my day-to-day with them in any kind of work that you might be doing. So I'd say if those few things feel like they line up with you, I think it would be a good fit.
Do you recommend getting like a master's and a doctorate, or do you think, like, I don't not set right now staying at a bachelor's, but do you think like you could do that and still be successful, or like what do you recommend?
Yeah, so if you're going to be doing any kind of clinical work, if you're doing any kind of counseling or any type of assessments, most places you'll need some kind of graduate degree to do that.
Okay.
So let's say you're looking at counseling, for example. you could do that in a couple different ways. Some people do get a master's degree in mental health counseling, or they get a social work degree with a specialty in mental health. So with that, you can do some counseling. You can do some good counseling if you do that. If you were to pursue a doctorate, it's a bit more specialized in things like assessment. So you really get a strong understanding of what a mental disorder looks like and how to assess for it, and it can make it a bit more clear on exactly how to treat it. So most likely, if you were looking to do some kind of clinical work, you probably want to pursue some kind of graduate degree. And you can do some of that with a master's, and of course some of that with a doctorate. There are a couple different types of doctorates that do allow you to do clinical work. So there's a PhD, which is what I have. And if you get a PhD, there's a pretty strong emphasis on doing research while you're in graduate school. So that will be part of getting a PhD. The nice part about a PhD is it's oftentimes funded by the school that you go to, which is really nice because you're doing research for the university. If you were to do what's called a PSY, a PSY period, D period, you can also do the same kind of clinical work. You'd be more likely to have to take out a bit more loans, usually for about 4 to 5 years if you were to pursue that way of going about it. If you're interested in the PhD route, and that would be the one that would be funded, usually they want you to have some kind of research experience and some good research experience before you apply, because they'll get a lot of applicants, and each school will accept 4 or 5, maybe 6 students. And so because research will be a really important part of what you're doing in a PhD program, they'll want to know that you're pretty comfortable with the research process and that it's something that you do well with. So what I always recommend to people is, if their undergraduate school has research programs and they have any faculty who are doing some kind of research, to ask how they can get involved. Because if you are involved in some kind of way and show that you worked well in the lab, set you up a lot better for if you wanted to pursue the PhD side of things.
Okay. So I've gotten a lot of advice today, but just to finish off, is there any extra advice or?
Yeah, additional advice. I think the big thing is the research side of things. Now, not every small school does a lot of research. You said your school is how many students?
2,000 maybe?
Okay. Do you know if any faculty members are currently doing research projects?
Not that I know, but I could look into it.
Yeah, so that would be the big thing. I'd recommend asking kind of what they might be doing. And if they don't, you're not too terribly far from some pretty big universities that do a lot of really good research. And that's actually how I got most of my research experience. It wasn't even at a school I was attending. So when I lived in Washington, D.C., I volunteered to do some research at the University of Maryland in one of their labs. And I think that experience that I got there was what allowed me to get into a PhD program. So I'd recommend looking into some research opportunities if it were something you're interested in. And if you were thinking that counseling, that side of things was what you were interested in, I'd recommend doing some looking into the differences between exactly what you can do with a master's degree versus a doctoral degree. You can do a lot of the same things. I'd say probably the biggest difference, again, is kind of strength when it comes to assessing mental disorders and understanding the assessment process. So I'd encourage you to just do some digging into assessment and kind of how important that is to you. And I think you might get a bit of a good understanding kind of next year when you're taking Abnormal Psych, because they'll be explaining different diagnostic criteria for different disorders. And the more familiar you are with them and thinking to yourself, how interested would I be in really understanding this side of things well, so that I can do good assessments for patients down the line. That would be a somewhat good indicator for you on if the master's versus the doctoral side of things would make a bit more sense. So that's what I have right now. Do you have any other questions that pop to mind at the moment?
No, that's it. Thank you so much.
You got it.